Good morning and welcome to the WellMed Charitable Foundation Caregiver Teleconnections presentation today on Alzheimer's, dementia, and the LGBTQ plus community. We have with us today two of our resident experts who we very much appreciate because they always do a lot of research and do a beautiful job. Dr. Elliot Sklar is a public health professional with 2 decades of experience in supporting the health of the public through academic work, research, and service. He has led healthy aging programs for seniors and the caregivers in Canada, Florida, and virtually. Dr. Sklar is a professor of health science at Nova Southeastern University in Florida. He publishes and presents his work internationally, focused on the complexity of issues related to aging and caregiving. And you can find him if you Google him online, and he likes that. So Lucy received her master's degree in social work from McGill University and has dedicated her career to supporting caregivers. Lucy was the founder and long-term manager of the Caregiver Support Center at a respite program for family caregivers. In 2003 and 2012, she received the Queen's Jubilee Award presented by the Canadian Home Care Association for her dedication in developing a national coalition to support caregivers. She's been a key architect of screening and assessment tools for family caregivers and providers, and she's taught them how to use those. Lucy would also like you to know, on a personal note, that she was a caregiver for her mother for almost 10 years. And with that, Lucy and Elliot, thank you for being here. Thank you for all the work you do for us, and please go ahead.
Thank you so much. Welcome, everyone. So, some of you participating today may or may not know that LGBTQ plus older adults exhibit several health disparities which increase the risk of developing Alzheimer's and other dementias. Just Google it and you'll see that. We have a lot of interesting information to discuss today, and also a number of really great resources that we curated specifically for our program. As always, we'll be sharing a copy of our presentation, and anytime you see anything underlined, these are hyperlinks so that you can access any of the websites we'll be sharing by clicking on them. So during our series this month, we've discussed how often LGBTQ plus caregivers, they feel more isolated, even though we tend to be caregivers at a higher rate than our non-LGBTQ plus peers, meaning more of us are caregivers. And yet, it's interesting that so many feel isolated in that role. We don't come together to really support one another as caregivers very much, and that's in part why we developed this series. A majority of caregivers, as we know, care for people with Alzheimer's and related dementia, and several research studies over the last years have suggested that LGBTQ plus adults have a higher prevalence and higher risk for developing Alzheimer's and related dementias. That's certainly concerning. So we're going to break down a lot of the research today, and most importantly, we're going to talk about some new research that was just published actually about 3 weeks ago, early on in June, and I think that that will shed some light, hopefully, and some new insight on the topic as well. So for years now, research, as I mentioned, has shown a higher rate of Alzheimer's and other dementia across LGBTQ adults. Now, initially, this research was very controversial. There have been additional studies showing a relationship between being a member of the LGBTQ plus community and having a higher rate of Alzheimer's and dementia, not unlike studies that have shown the same thing among Black and Hispanic communities. Nevertheless, it's something that I've certainly not heard when it comes to addressing health issues in the LGBTQ plus population. For example, doctors do not provide specific care for LGBTQ plus seniors to screen for memory and cognitive function more routinely, or perhaps they may not pay more attention to this at all. Now, this is a topic that we have received a lot of questions about over the years during our Pride of Caring series. Are, in fact, LGBTQ plus adults at a higher risk for Alzheimer's and other related dementias? So this is a question we're really going to delve deep into during our time together today. Now, it's really important, I think, that we all begin with a basic understanding that we still don't know exactly what causes Alzheimer's and other related dementias. We're moving closer, but we still have a lot of questions that need more answers. So, the research that exists does not imply some sort of a genetic link between being, for example, gay and developing Alzheimer's. Rather, there are some overall health and social issues that may be factors in explaining this relationship. Other research has come out linking environmental issues and risks with the development of Alzheimer's and related dementia. That polluted city environments, for example, can play a role. And we know that many older LGBTQ adults live in larger cities, for example, New York City or San Francisco. When looking further, a lot of the research links other health conditions and health disparities, which might be a factor in this increased prevalence. So we're going to talk about that today as well. Now, we're still without many treatment options or a cure for Alzheimer's, again, because we really don't know quite why it happens. So that means that for elders in the LGBTQ plus community, we need more care and we need to plan for more care. We need to have people around, obviously, to provide care for us should something happen later in life. And that means we need more support, more awareness of this issue. And as people are overall growing older and living longer, that means that there will be, again, more Alzheimer's and related dementia based upon current trends. Now, my doctorate in public health is specialized in an area called health promotion and disease prevention. So we work together to frame, Lucy and I, to frame our discussion by first breaking down what the research tells us about the links between Alzheimer's and related dementias in the LGBTQ plus population, and then also what we can do to promote our health, to prevent these diseases as best as possible, and also how caregivers in the LGBTQ plus community can access specific resources and supports for them.
Thank you for that, Elliot. You know, I'm always kind of blown away about some of this research, especially there are more than 7 million people in the US with dementia, according to the publication Reference Bureau, and 6.5 million of these cases are caused by Alzheimer's disease. You know, as the US population ages, this number is likely to increase. If current trend persists, 9 million people will have dementia by 2030. And that's not really far away, just around the corner. Each year, more than 16 million Americans provide more than 17 billion hours of unpaid care for older adults with Alzheimer's disease and related dementias. While all caregivers of people with dementia or other health challenges can benefit from support services and have common barriers, caregivers within the LGBTQ community have unique experience and needs, very much what Elliot was talking about. There's also a growing body of research, Elliot mentioned, that suggests dementia is more prevalent among the LGBTQ people than among their straight counterparts. A 2019 study led by the School of Nursing at the University of California found that LGBTQ people over age 65 are 29% more likely to report memory loss symptoms. Now, another study focused on Medicare recipients by the Center for Health Promotion and Health Equity at the Browns University found that nearly 20% of transgender people over 65 have dementia, compared to 12% of cisgender people over 65. Cisgender people are people whose gender was identified, registered at birth. Alzheimer's disease and dementia progressive conditions that primarily affect cognitive functioning, memory, and behavior. They're often used interchangeable. But it is important to note that dementia is an umbrella term for a range of symptoms that include memory loss, cognitive decline, while Alzheimer's disease is the most common cause of dementia. Understanding the links between Alzheimer's, dementia, and the LGBTQ community requires exploring several factors, including unique risk factors and social determinants of health and the healthcare disparities that affect this community. So that's what we're going to kind of look into a little bit more. LGBTQ adults also face the additional burden of discrimination and social stigma, which can impact their access to medical care and social care services. LGBTQ caregivers, whether it be close friends or family members of a person with dementia, may also be dealing with their own quality of life changes, especially if they're aging. Now, let's look at these healthcare disparities, differences in the health between different groups of people. LGBTQ plus people experience a number of health disparities. They are at a higher risk of certain conditions, have less access to healthcare, and have worse health outcomes. Now, these disparities are seen in the areas of behavioral health, physical health, and access to care. So if we look at the behavioral health, includes mental health, obviously, substance abuse, addiction. LGBTQ people are at a greater risk of suicide and suicide thoughts, mood disorders and anxiety, eating disorders, alcohol and substance abuse, tobacco use. Now, those are just some of the symptoms that really are attached to this research. Now, there's also physical health. LGBTQ people are at higher risk for certain conditions, diseases, and infection. These older adults are more likely to rate their health as poor and report more chronic conditions while having less social support. They are less likely to have a regular healthcare provider. There's a difficulty in access to care. People have less access to the healthcare that they need in the LGBTQ community. Less likely to have health insurance, more likely to delay getting care, especially in older LGBTQ adults, more likely to report poor quality of care and unfair treatment by healthcare providers. So let's look again at what causes these disparities. There are many causes of health disparities faced by the LGBTQ community that include the whole idea of the minority status of the LGBTQ people, a lack of specific education and training for healthcare workers, a lack of clinical research on LGBTQ health-related issues, and fear due to stigma, discrimination, and institutional bias in the healthcare system. So having said all that, and we're going to go into it a little bit more, I have a question. Does any of this hit home for anyone? Have you experienced any of this?
This is your opportunity, folks, to either go to the chat room or unmute yourself or put your hand up, or if you're on the telephone, you can push *6 and I can see that you would like to talk to us, and we would certainly like to hear from you. Elliot, I couldn't help but think when you were talking about the expanding of the aging population, we already are short on caregivers. And as the population goes up, the number of caregivers as a percent are going to go down. What a scary thing. And I'm old, so I'm scared.
Yeah, absolutely. You know, we've done a program talking about millennial caregivers. But if you look at trends, you know, millennials have less children than their previous generation, and younger generations beyond them are having less and less children. So there's an implication there for caregiving, which we know certainly exists in the LGBTQ plus community. Many of us don't have children, and so there's a lack of generational caregiving, which, you know, typically occurs.
Right. Okay, anybody before we go on? All right, we have other opportunities.
Absolutely. I think a clear health disparity is what I was speaking about earlier. As far as I know, when I speak to older who are members of the LGBTQ plus community, I don't believe that primary care physicians screen for cognition and memory among geriatric LGBTQ plus patients at a greater extent or frequency than they do other populations. And just that right there, if the research does in fact indicate that there is a higher risk or prevalence, that would certainly seem logical to me that doctors would screen for that. So the fact that this is something not discussed in our healthcare training of physicians, social workers, geriatricians, that's a concern. But it's not just the LGBTQ plus community, as I mentioned. Hispanic communities, Black communities also have higher risk and prevalence according to research for Alzheimer's and related dementia. So let's look at the research a little bit more. Suggests a relationship between LGBT adults 45 and older and Alzheimer's and related dementias. But the research really looks at a lot of different things. And in fact, the CDC study suggests that this increased prevalence of Alzheimer's and related dementias among LGBTQ adults came from an examination of national data from what is called the Behavioral Risk Factor Surveillance Survey. It's a data set that I'm very, very familiar with because I use it with many of my doctoral students to look at trends in data. And so this is actually publicly available data that is collected and made available so that researchers can use it to draw connections between things. And I use the word connections between things carefully because we can't make inferences, we can't draw conclusions. So for example, we could use the same data to see if there's a relationship between alcohol use in terms of frequency or total amount consumed and increased risk of Alzheimer's or prevalence among those people who reported using alcohol. Point being that all of this data comes from people who self-report behaviors and health conditions, including their own cognition. Now that's a very big limitation for this kind of research. In one study, the highest risk factors from an analysis of data showed that high blood pressure was actually the thing that was the greatest risk factor in terms of the development of Alzheimer's and related dementias. Next up was not meeting aerobic exercise recommendations. So that's your cardio, your walking, your biking, and then obesity, diabetes, and depression. And that's very interesting as well. There's a new study that just came out showing a bidirectional relationship between Alzheimer's and related dementias and depression. So that if people are more depressed, there's a greater connection with Alzheimer's and related dementia. However, people with Alzheimer's and related dementia also had more depression. So that's that bidirectional relationship there. But in this specific study from the CDC that uses this national data set, LGBT adults had reported more depression, less exercise, as well as other risk factors, as well as indicating cognitive decline of varying degrees. Now, the study looked at modifiable risk factors for Alzheimer's and related dementia among all adults 45 and older. But in that entire data set from the study in 2022, there were only 3,200 LGBTQ plus respondents. And my question is that enough people from our entire population from which to draw connections? I'm not so sure. But this is not the first time that data like this has found that cognitive health disparities do exist among LGBTQ plus adults. Chronic minority stress over the life course heightens risk of premature cognitive aging and other cognitive decline, and this has been found among LGBTQ plus adults. Using the 2015 to 2018 behavioral risk factor surveillance survey. And again, the data from these surveys are only published a few years later than when the study was actually done. So it was published in 2021, found again that LGBTQ plus adults 45 and older were more likely to report subjective cognitive decline than their counterparts. Specifically, that LGBTQ plus adults also face compounding factors like diabetes, high blood pressure, depression. So again, these are the risk factors that we know exist across the population. So if our community members report more of that, then naturally in that sample, it would be logical to find that there is a greater link between Alzheimer's and related dementia reported by people along with these health disparities. So there are definitely some relationships with other health factors among adults in our community, but that may not reflect all community members either, depending on your own health circumstances. And I think we're seeing a trend of people sort of paying a little bit more attention to their own health, trying to age better in better physical and mental health in terms of community supports too.
Thank you, Elliot. You know, these are very good points, and we should look more closely at the research and at risk more independently. You know, these specific risk factors may not apply to all LGBTQ adults, and many are in fact more active than their non-LGBTQ counterparts. That's why it's important to look at research very closely and not just the headlines of it and what it actually means. You know, but what it sort of tells me is that we really have to take control of our own well-being by doing all the right things. You know, in addition, there are health risks of loneliness. Now, this one is something that's really important. And current research suggests that lesbian, gay, bisexual populations experience loneliness more often than other groups. Although it's hard to measure social isolation and loneliness precisely, there's strong evidence that many adults age 50 and older are socially isolated or lonely in ways that put their health at risk. And so that's really interesting to keep in mind. Now, recent studies found that social isolation was associated with about 50% increased risk of dementia, which is quite shocking, I have to say, you know. And we talk a lot about this, Elliot, in other sessions as well, how important it is not to isolate yourself. Loneliness was associated with the higher rates of depression, anxiety, and suicide. We have an amazing resource on screen for SAGE content, which is a program of volunteers who have phone check-ins with isolated LGBTQ seniors. And I hope if any of you need that, you will use that resource. There are other ways in our society in which Alzheimer's disease, dementia, and the LGBTQ community are interconnected. For example, living alone is a good example of one of these connections, as we know that more LGBTQ adults live alone. There are consequences of loneliness, but living alone can also be different in how it can affect this issue. You know, living alone can increase vulnerability to Alzheimer's and dementia and the LGBTQ community. Social isolation and limited support networks can lead to reduced cognitive stimulation, kind of makes sense, increases stress and limited opportunities for social engagements, which are crucial for managing your brain health. It's so important. Now, living alone may also result in decline detection and diagnosis of cognitive decline. You know, there may be no one close to the individual who can observe changes in behavior, memory loss, or other symptoms, leading to a delayed understanding of the condition and subsequently intervention. So if you're alone and you don't realize it, you're not going to get checked out as quickly as you should be. Now, caregiving challenges. So let's look at that. Living alone can pose additional challenges when it comes to caregiving for individuals with Alzheimer's or dementia. The absence of a partner, a spouse, or close family member may limit the availability of informal caregivers, which really kind of necessitates reliance on formal care services that may be less inclusive or understanding of the LGBTQ identities. Now, believe it or not, increased boredom of LGBTQ individuals living alone with Alzheimer's or dementia may bear a higher burden due to the lack of boredom due to the lack of support system. They may face difficulties in managing day-to-day activities, coordinating medical care, and navigating legal and financial matters without the assistance of a partner or family member. So that's a lot that we kind of have to look at. So if you're a healthcare provider and you do have a client who's an LBG in that community and is living alone, it's important to really keep that in mind. So I have a few questions now if anybody wants to get involved. And one of them, does anyone have any questions or anything that you would like to share about all the things that I've been talking about, and Elliot as well?
So folks, this is your opportunity. Open up your line. If you're on Zoom and if you're on the telephone, you can press *6 and you'll open your line. And I have a little website that I can see that you've done that. And we really, really would like your input because it makes our podcast, nobody can help a caregiver like another caregiver. So we'd love to hear from you. And you'll get other opportunities if you're not ready right now.
Well,
Elliot?
let me throw something there. Somebody trying to say something?
I was going to ask Elliot a question. You go ahead.
Oh, no, I was just going to say the other thing that we're wondering, do we have any people, do you know any people who live alone, and how does this information make you feel? I mean, is it something that you're kind of more aware of?
Okay, let's see. Lucy, you and I live alone.
Well, no, it's a good point what you're making, because maybe you can have a bit of a discussion with Elliot informally a little bit. Well, it's associated with it. You have to look at it. Are we lonely? Or, is there loneliness? Do we feel isolated? So, not necessarily, but what I'm also wondering about in general in the population, seniors who do isolate themselves, and even caregivers are at a high risk for all the things that we've been talking about.
Absolutely. And they lose their driver's license, so they can't drive, and inflation happens, so they can't afford to take a taxi or go out to eat or do the things they used to try to get some socialization. So it's tough on people. It's really tough.
And if there are any healthcare workers that have joined us today, I mean, that's one of the things that's making me very much more aware of what I, as a healthcare provider, the kind of questions that we should be asking, knowing the research and the findings. So that is extremely important, and educating our healthcare practitioners in all respects, doctors, nurses, social workers, aides, whatever.
You can always put it in chat if you don't want to unmute yourself, but we would love to hear from you.
Evelyn, you had a question.
Yes, go ahead.
It's a little bit tangential, but you said that there were 3,200 LGBTQ plus community members who were part of this survey. And I thought to myself, we have an idea how many people have dementia in the country, an estimate. Do we have an estimate of how many LGBTQ plus people there are in the nation, and how many of them have dementia?
So it's an excellent question. And we know that the problem with this type of research is, number one, it's often not collected. Number two, it's often not accurately reported. A lot of people don't want to necessarily out themselves in paperwork or something that might be tracked back to them, especially if it links with their health. There are certainly ways of doing sample studies, for example, within populations, within long-term care facilities, Medicare, for example. But again, you will find that a lot of people will not self-disclose. I think the key to what Lucy and I are trying to convey in all of this research is that, yes, if you Google, are LGBTQ plus adults at greater risk for dementia, artificial intelligence will scour the research and tell you that the answer is yes. And the answer is yes, according to the research, and it's good quality research. There's nothing wrong with it. But we have to question the research. And is a sample of 3,200 people as compared to 200,000 plus of their non-LGBTQ plus peers in that research, is that sufficient to draw conclusions from? Furthermore, maybe we should be looking at these risk factors more specifically, like hypertension, diabetes, depression. And maybe we should be looking more closely, for example, because as we're talking about, living alone doesn't mean the same thing for all people. Living alone might increase your risk according to the research for certain things, but we don't know about these people's social networks as an example. So Lucy brought up a great point. Does living alone mean that you're lonely? And for many people, it does not. So we need to look more closely at the research and not feel that it's a scarlet letter on our community or something like that, that we're at a higher risk. There are more individual factors, at least in my opinion.
Thank you for your thoughtful response. That was great. Anybody else want to chime in here? Lucy's just going to ask you more questions. You might as well come forward now. Okay, we'll get you later. Oh,
No pressure. No pressure.
Stephanie.
Stephanie says, I apologize for coming on the call so late. I have background noise, so I can't unmute. Living alone in general, isolation is difficult for people and a high risk factor for brain changes. People need to be around people. People need sunshine and oxygen and social interaction. I agree with that, Stephanie. In fact, I encourage people to even interact with your grocery store checkout clerk. I've mentioned before that Trader Joe's, if you have one near you, their cashiers are trained to be incredibly engaging. They'll comment specifically about the things that you're purchasing and if they like them or not, and have you tried this? And it's a way to make people feel more engaged in the store. But you leave there feeling good. And it's a whole psychology behind it. So if you're someone who lives alone, it's a great example that you can have these little meaningless interactions with people, but they're much more meaningful than we think.
Thank you for the question or the response.
Absolutely. All right, I'm going to keep going. So, I hope that what we have talked about sort of made some connections for some of you, because there's a lot of research out there, but not a lot of really thoroughly examining what the findings are. And as I mentioned, there are other communities that have also higher rates of Alzheimer's and dementia, according to the research, like Black and Hispanic populations. And we still have a lot to learn. Now, it's been said before that we don't have a healthcare system. We have a sick care system. And our system is designed to care for the sick, but we don't invest in keeping ourselves well and healthy. So here is some information for you. Despite dementia being incurable, it is not inevitable. A 2020 National Institute of Health study found that at least 35% of cases of Alzheimer's and dementia could be changed if people were to address behavioral risk factors. For example, depression, substance abuse, social isolation. So if the LGBTQ plus community faces these problems disproportionately, then making progress against dementia in this population will need to involve solutions for these people. enabling people to be able to lead healthier lives. So, for example, we talked about how important mental health is in preventing cognitive decline, taking walks, being outdoors, interacting with someone in the checkout line. These things actually do help to lift our spirits, and there is a lot of research to support that. Many people don't know about the risks of social isolation that Lucy talked about. Knowing that alone can give us more of a kick in the butt to be able to get more engaged. People get engaged through religious groups, choirs, volunteer work, taking an art class, different strokes for different folks, pun intended, because I said an art class. Now, we talked about high blood pressure being the #1 link in studies for development of Alzheimer's and related dementia. Well, walking is really good. Several recorded presentations that are focused on health promotion for caregivers. These programs are actually linked here on the bottom of your screen. We did a series called Your Health is Your Wealth, and we focus on nutrition and exercise and all the things that are important for potentially improving cognition. You can find them again on the WellMed Teleconnection YouTube channel. And I think that we need to really rethink how we care for our health and how we can prevent or delay potential diseases. The National Institutes of Health announced that researchers have recently developed a blood test that could detect Alzheimer's disease promoting compounds in the blood long before symptoms emerge. So if that test is successful, that could make strategies to intervene before brain damage occurs possible. Now, we know the role that lifestyle plays, like diet and exercise, helping to improve cognition. In other programs, we've talked about the blue zones. So we know that there are things that we certainly can do. And I see we have a comment here. Stephanie said employee training to understand some people need extra time to process their questions or menus. Train new employees to have compassion. Dementia Friendly USA has some good info too. Yes, all good points. Thank you so much. One moment. Sorry about that. The heat and the humidity have really triggered my asthma and my allergies. Now, I think in light of everything we've discussed today, what do we do? So Lucy?
Okay, so right, what do we do together to address these issues? And okay, so I think what's important is community support, creating inclusion and supportive environments within the LGBTQ community that foster social connection, reduce isolation, and provide resources for individuals living alone. Very much what I said before, to be very aware of that within the healthcare providers. Education and awareness, increasing awareness among healthcare professionals, caregivers, and the broader community about the unique needs of the LGBTQ individuals living with Alzheimer's and dementia. Now, caregiver support, offering tailored support services and resources for the LGBTQ caregivers, including legal and financial assistance, respite care options, and mental health support. By addressing the links between Alzheimer's, dementia, the LGBTQ community, and the challenges faced by individuals living alone, we can strive towards improving support, inclusion, and care for this population. But I just want to go back that it's also an individual's responsibility to take care of ourselves. You know, if you know that you're at a high risk for certain factors, do something about it before it's too late. And I believe wholeheartedly that it's never too late to age well, regardless of what community you're in. If you decide that tomorrow is the day I'm going to start walking, it's going to improve. It's never too late, no matter how old you are.
That's right, because aging is not a disease,
No.
right?
Exactly.
Seems like it.
Well, then Evelyn, you talk to your primary care physician and get yourself in check.
Exactly.
I saw something very cute this month for Pride Month, that an older person had. It was a T-shirt that said, "I'm here, I'm queer, my back pain is moderate to severe."
I'm there.
Listen, it's good to laugh and to have levity, especially as we talk about things that are, more difficult. And no one wants to feel that they're part of a group that has a higher risk for something incurable, right? So that's why I think it's important that we look at all the things that we can individually do, and that these risk factors are actually much more individual and granular. We need to not look at the headlines, and maybe it's a more personal thing. I also really believe, of course, that we need much more research. As we were talking about earlier, Evelyn, you had asked a great question about the population included in the sample, and do we know as a whole nationally how many people have dementia and Alzheimer's, and how many of them identify as a sexual minority group? We don't know, at least not accurately. So that's why researchers use the publicly available data of what people self-report to be able to draw these connections. But these connections are far from conclusions. And also these samples are based upon self-report often. And so there's a huge limitation in that research, which never makes the headline. So researchers are certainly continuing to advance community engagement efforts with older LGBTQ plus populations. And there is a large study called the RISE Registry, and hopefully we'll gain more information from that. But considering adults from different cultural backgrounds often also place a different engagement in this type of research. This research has the potential to improve health outcomes for the population. And as an example, to center LGBTQ plus communities in Alzheimer's research, researchers have developed this RISE study. And what it is it's a registry that includes LGBTQ plus adults who have self-identified a memory concern or memory loss, a diagnosis, or if they have a partner that they care for example. So again, we have a hyperlink here. If you are watching this or participating today and you want to take part in this study, we certainly would encourage you to do so. There are also great resources for participants. But I want to share, as we mentioned earlier, a piece of research that came out just about 3 weeks ago. And it is the latest, greatest, and newest research that we have on this topic. And it came out after we actually put this presentation together, but we felt that it was so important to include. And it discusses the fact, and I would like to actually read it verbatim. It was published on June 3rd in Frontiers of Human Neuroscience, and it is made available through the National Library of Medicine. So it is a very high quality piece of research that may make us rethink this issue. And it really echoes a lot of what we were saying today. The study states, and now I will quote, over the last decade, research on the health of sexual and gender minorities, SGM, they use different language than we do for LGBTQ+, and they include lesbian, gay, bisexual, transgender, queer, and people with other sexual orientations and forms of gender expression. So a very all-inclusive acronym there, SGM, has been expanding to explore cognitive decline and dementia risk. The field still represents a small niche, especially when compared to research on sexual health and HIV. Indeed, data on neurological disorders in SGM populations or LGBTQ+ populations are very scarce. For instance, a recent review of 348 neurological studies found only 60 studies focused on cognition of SGM or LGBTQ+ people, only 6 of which, so that's 10% of all the research, was unrelated to HIV. As a result, it is currently not possible to draw definite conclusions on whether SGM or may have an increased risk of cognitive decline. I think that's great news. So it really echoes what we were saying. There's just not enough research out there. And that is why the RISE registry exists. That's why we were talking about the need for more research. And I was thrilled that we found this newest, latest, greatest piece of research that looks at all of the studies that have come before it, all 348 of them. And of those, only 60 focused on the cognition of LGBTQ plus people. And of those, only 6 were not related to HIV. So 6 studies, that's not enough for us to make any kinds of conclusions. And I think that it's more important that we look at those individual risk factors and focus upon those. So I hope that we shared some really new research that helps to illuminate the connections that you may have heard or that you may have read about. Because as I mentioned, if you Google, do LGBTQ plus adults have a higher risk of Alzheimer's? Google will say yes, because that's what most of the research says. But it's still very limited. Any questions, comments?
Come on, folks.
We have a lot of resources to share with you all, which I'm going to post now. Anything that you see that is underlined in blue is a hyperlink so that you can just click on that when we send out our presentation slides, or if you are watching this as a recording. And I want to thank our participants so much and invite you to, again, ask any questions or comments that you have.
And I have my website open, so if you open up your line, if you're on the phone, press *6. You can chat, you can put your hand up, you can unmute yourself. We would love to hear from you.
While people are thinking, I want to just share one last thing. There was another piece of research that just came out asking about the experience of LGBTQ plus caregivers whose partners are in long-term care. And what they found was that these caregivers did not experience any additional discrimination, prejudice, anything like that. In fact, they were pleasantly surprised not to have experienced those things. So that research was also encouraging, but it also indicates that we as a community have some self-work to do and recognize that just because we may have had some bad experiences doesn't mean that moving forward we won't have good ones.
Okay, folks, any other questions, comments? Lucy, did you want to?
No, I'm just saying that it's quite positive what you're saying, and I think it's important to keep that in mind.
Well, I'd like to say that your Pride months have been so informative to me. I wish that we could have every social worker, every mental health worker, every healthcare provider, listen to these, because it certainly has expanded my wanting to know more, my wanting to be more inclusive, and my comfort with working with people who are LGBT plus. So I thank you so much. And I always appreciate your research, which is top notch. And I appreciate the wonderful messages that Lucy brings to us that are really about our own personal selves and our own personal responsibility for taking care of ourselves. So thank you folks so much for all the work you did on this. Oh, I think we have something in the chat.
So thank
you for the great information. I will use these resources in my work at BSWH. I have to drop off. Thank you, Donna.
Okay, anybody else? All right. I want to thank you all for participating today. You will be able to look at this podcast or refer your friends to it or other caregivers to it in just a day or two. And you will be getting the slides that Minerva will be sending out. And I also like to thank Lucy and Elliot. They do such a great job. and the WellMed Charitable Foundation for putting all this together, getting these great speakers, really helping the country understand, about the LGBTQA population, as well as dementia and the heavy caregiving issues that, affect so many families in this country. Anybody else have another chat? I have another chat here. No, it was Minerva saying that she loves it. Minerva, we love you. Thank you so much. She's our support fabulous person. All right. Well, with that, I will let you know that this is the last presentation this week or this month. And we have one coming up next Tuesday. And it is Ask Questions of Tam. And many of you probably have done this. Tam Cummings is an expert, a PhD in Alzheimer's. She is able to answer pretty much anything you ask, not particularly for this community that we're talking about today, but in general, and she is very smart. And that will be at 1 o'clock Central Time next Tuesday. So that's the 2nd. So we hope that you will take advantage of that, because she's great and she can answer a lot of questions too. Write your questions down, maybe even before you get to the presentations, because they really help the presenters, they help the podcast, and hopefully they help you too. So with that, I'd like to thank you all. Lucy, Elliot, great job. Thank you folks for joining in and listening. And I will close the recording now.
Thank you so much.
Thanks, everybody. Take care of yourself. Bye-bye.
Bye.